and welcome to Keep Talking, a community dialogue about mental health. My name is Gay Maxwell, and I am the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is a 183-year-old addictions and psychiatric hospital located in southeastern Vermont. It serves adults, adolescents, children in a variety of inpatient, outpatient, and partial hospitalization programs. The Brattleboro Retreat provides care and courage when being human hurts. Today in our studio, I am thrilled to have as our guest Dr. Reid Wilson. He is an international expert in the treatment of anxiety disorders with books published in 9 languages. Those books include Don't Panic. He is the co-author of Stop Obsessing, the co-author of Anxious Kids, Anxious Parents. He's also the director of the Anxiety Disorders Treatment Center in Chapel Hill, North Carolina, and adjunct associate professor of psychiatry at the University of North Carolina School of Medicine. Reid Wilson, thank you so much for appearing today. I know you're taking time out from your busy schedule in Chapel Hill, correct?
Well, I'm always happy to talk to you, Gay.
Me too. I'm always happy to see you. You will be presenting an all-day conference next fall through the Brattleboro Retreat's Office of Continuing Education. And that particular conference is focused on treating generalized anxiety disorder, panic, obsessive compulsive disorder, as well as phobias. And that program, which is on September 16th, is really focused for mental health professionals from all over New England. But you have also written a very exciting book, which I'm going to display right now, which is called Stopping the Noise in Your Head, the new way to overcome anxiety and worry. And I figured this was an opportunity for the rest of us to learn a little bit more about your take on worry and anxiety. So what is worry, Dr. Wilson, and why do we seem so pre-programmed to have it?
Well, thank goodness that we do, because worry is really supposed to be step one in the problem-solving process. If we don't worry, we don't prioritize our tasks, we don't get motivated to accomplish something, we don't put an order to the things that we're doing, we don't become alarmed when we need to become alarmed and start to respond to things. So it's a very important signal for problem solving. The difficulty is that worry is only negative. So you only hear the negative, and you are not open to the positive at that point. So one of the things we need to pay attention to is when worry is repetitious, unproductive noise, we want to recognize it as such and begin to change things around, because all worry comes through as a signal. All worry comes through to have us say, you got to wake up, you got to do something, there's something wrong. And we have to sort through, but we only have to sort through in 2 ways. Is this a signal or is this noise? Signals, we problem solve. Noise, which is really what the book is about and what the mental health workshop is about, we can do lots of things to noise. People just tend to do the wrong things when they worry.
Well, I was intrigued with this whole idea that you talked about in your book about how we somehow are programmed, or our brains fool us into thinking that the worry is actually the problem solving itself. That somehow we think if we keep worrying, that's actually doing something.
Right. And, some people have a kind of personality that does that too, but worry's going to repeat itself over and over again until you take action like it thinks you need to take action. If you have this happens to me sometimes, laying in bed at night, I'll have, some idea about something I'm working on. Well, I can say, okay, well, I'll have that in the morning. I'll remember that. And then I'll close my eyes or try to go back to sleep. And then there it pops up again and again. And what I do is I just take out a piece of paper, write down what it is that I had the idea about, and put it on the floor. Now I've, in one way or another, handled it. I'll see it in the morning, and now my worry will quiet down.
So
otherwise, it's the front of our mind saying, I'm tracking this for you. And that's that's what it's doing to try to help us. And we have to intervene because the unconscious is too primitive in this way.
Why do certain brains go into overdrive that way?
Well, I think all of our brains can do that if it seems congruent to our thought process. So the example I just gave, there is, in my mind, I'm saying this is an important idea. Mm-hmm. So the brain is kind of taking care of me to do that. Then we have people who, as I mentioned, have a character that's a little more vulnerable to this. We have some genetic predisposition for some people. It tends to, as you're saying, treat worry as problem solving. As long as I keep thinking about this, nothing bad's going to happen. Mm-hmm. So we just have to bring it under control. I think also this is the midbrain. So this was formed a long, long time ago. It hasn't caught up with much of the social and psychological stresses that we all face today. It was developed when our stresses were mainly physical and threatening in that way. So, mm-hmm. I think in another 10,000, 20,000 years, we'll have caught up, but not yet. We're mm-hmm. going to have to bring some conscious control here.
Mm-hmm. So when does worry spill over into anxiety, or are they the same thing?
Well, there's always a little anxiety when worry shows up. That is, the amygdala secretes a little epinephrine. We're more alert. I mean, that's what worry does. It alerts us a little bit. It keeps us preoccupied. And then as soon as that starts intruding as opposed to being helpful, as soon as that subroutine of worry starts showing up whenever the heck it feels like showing up, that's when we got trouble. If I'm unemployed and I'm a single parent of 2 kids, I'm going to worry about when am I going to find my next job. So that's a legitimate worry. That's a signal. But the disorder of worry comes in and hits me all day long about that. And that's what's not productive. I need to, have that worry and then kick in the problem solving. And other times during the day, I got to be able to cool out. I got to be able to say to worry, not now, Buster. This is my private time. Or not now. It's 3 o'clock in the morning. I've declared this as sleep time. So even if a worry is a signal, for instance, in the middle of the night, I'm being signaled about something I need to act on, I've declared 3 o'clock in the morning as sleep time. So we need to have a way to push that away.
It's almost as if you're talking about anxiety as being outside one. I mean, it's one of the themes in your book about looking at anxiety as an opponent. You use a lot of sports metaphors, boxing, poker, chess, and kind of making that anxiety into an avatar that you've got to outmaneuver.
Sure. Well, yes, and I hardly ever call it an opponent, but I'll call it a challenger. Right? Because, again, all worry is not bad. All anxiety is not bad. We need to sort that through. But when we recognize it as noise, then that's the challenger. And we really do want to detach from it and put it outside of ourselves. Of course, it's kind of a crazy thing to be thinking about. But it is the protocol that's going to help us consciously understand this the best. Instead, even working with children, instead of them talking about, I worry all day, we can help them go, my worry shows up and gives me these thoughts all day long. So now we've got that identity. And now we can go, so when that worry shows up, see, we've already got a gap. There's a gap between me and that worry. Mm-hmm. Now when it shows up, I can respond to it in a different way. We are not going to fix worry. We're not going to get rid of worry. Mm-hmm. We need to focus on how we respond. So in so many people I work with, this is the problem. They come in totally understandable with the goal of getting rid of the physical sensations of panic, getting rid of the anxiety that comes with social circumstances where I feel insecure. That's not the right way to work therapeutically, though, because as soon as we work on trying to push something away, it's like going out and pushing your nephew on the swing. As soon as you try to push away these negative thoughts and feelings, you are energizing the system. You are going to have that swing come back at you with stronger force. So the treatment, the way we need to work with ourselves, is going to be paradoxical. Seems opposite of logic. Mm-hmm. I should be working on pushing away negative thoughts and feelings. It doesn't work that way.
And so how does it work? How do you work with adults per se? You talked about children, but adults in creating that separation between themselves and the worry, the noise.
Sure. And I can say to you, sitting with somebody across from me in therapy, they can make that separation in a moment's time. And for many of the times, all I have to say is, so when your obsessions, when your OCD shows up, how do you respond? And then they start talking like that with me. And I certainly introduced the whole idea to them, but it's easy to accomplish that. Mm-hmm. So once we have that in place, then what I want to focus on, we've got lots of gimmicks and tricks and so forth. It all comes down to stopping resisting. Mm-hmm. If I can stop resisting and fighting, then I'm gonna win this battle in the end. Now, we might talk about that as mindfulness, is to be present with it and not get engaged with it. But we really, I think, initially, worry and anxiety are so strong in so many of the people that we see that we can't immediately get them to step away, to step back. We have to teach them to do something, and I do more of aggressive, which is welcoming it. If we've personified it, almost sarcastically, oh, please give me another threatening thought about the cable going to break now while I'm on this elevator, right? I need to know, as the client, if I'm afraid of elevators, that the elevator cable is not going to break. That's a ridiculous thought, but I can't seem to get rid of that thought in the moment I'm trying to take the elevator. So I'm going to start, being a little more provocative with the phobia to say, hey, give me more. That's what I'm looking for. So there's some kind of cunning ways to talk to it, but also we have to talk to ourselves. It's a very big part of this work.
I was going to ask you about that. I mean, I talk to myself all the time. My children and my husband tease me constantly, but I'm extremely fascinating person, so I don't know why it bothers them so much. But at any rate, I'm
in your own mind. At least.
Yes, exactly. So, but how would a worrier talk to themselves differently? What are the suggestions you make?
Sure. Let me step back to say 96% of adults say, I talk to myself. 25% of our day is spent in self-talk. That's a huge amount of time. So if I'm saying, where I get stuck, I have to get rid of this, this is bad, this is wrong, something terrible is going to happen, I'm gonna suffocate on the plane. So all of that grouping of conversation we need to maneuver around. One is, again, with people with phobias, fear of flying or claustrophobia or elevators or whatever, we need to correct information. So if I've got panic disorder and I think I'm having a heart attack every time I have a panic attack, we have to fix that. We have to say, even though I feel as though this is a heart attack, this is a panic attack. That's got to get cleared up first. Mm-hmm. You have to trust the airlines before you can work on self-help stuff around fear of flying. So that has to get clarified. And then we're talking to ourselves around, we're going to hear it, there's the voice. So we want to step back and go, oh, there it is. We want to label it as noise if it is. Or a lot of times, it's interesting, we have to act as though it's noise. Because so many people have this intolerance of uncertainty. And so in the moment, so you can be sitting there in a no problem time and go, it's crazy that I have that thought. In the moment of the threat, though, that thought comes back and it gets a little confusing. Is this noise or is this signal? So in the moment of the threat, I very often have to say to myself, I'm going to act as though this is noise because I can't get closure. I can't guarantee, people who are anxious have possibility thinking, not probability thinking. So even if the probability is 1 in 17 million, there's a chance. That's how they think about it. So you were asking me how do you say it, talk to yourself. So, one is I'm going to act as though this is nothing I need to pay attention to. That in itself is a message that I give myself. The other is, I can handle this. You're these rush of sensations. Oh my God, I'm gonna die. Has to shift over to go, wait a minute, this is really uncomfortable. I can manage this. Let me just stay with it. If we're talking about somebody with social anxiety, afraid that they're going to be judged by others when they give a presentation. Well, first off, you'll get judged by others. That's, you can't be saying, oh, everyone's going to like me. That's not true. So, we don't need that kind of closure. What we need is, yes, maybe people will judge me. Maybe I'll make a mistake and they'll be critical of me. I can handle that experience. So really, very simply, if we're talking about how to talk to ourselves, we're going to go 2 ways. One is 3 ways really. Going to make sure when I think, oh my God, I'm going to run out of air, I'm going to go, no, it's not about suffocation, right? Second is, I can handle these feelings. This is uncomfortable. I can handle the possibility of being criticized, even though that's uncomfortable. And then third is this kind of cunning way of talking back to the anxiety itself, which we probably don't need to do much details on this particular session with, but it's also a great way to be more provocative.
You talk about that throughout the book, about learning to be cunning with anxiety. Can you give some examples or maybe some what that would look like?
Sure. I do a whole by the last chapter of the Stopping the Noise in Your Head book, I have a whole point system where you're set up to score points in order to learn how to do this, and you score a point by when you have a thought or feeling that bothers you. Now, any kind of performance, we're going to have some anxiety and some worries, and that's fine. We don't have to get rid of those. But if you're having that and it's troubling you and bothering you, you want to step back and recognize it, and then you want to be okay with that. I accept that's just shown up, and now I want to go ahead and step forward anyway to whatever I'm doing, and then I want to say something either to myself or to anxiety. We talked a little bit about what I would say to myself, and then to anxiety, you want to think about saying something like, thank you. Again, this is advanced intervention, right? Thank you. Would you please give that feeling to me again? Right? Can I digress to a little story about
Absolutely.
myself? I love the Canadian Rockies, and I've hiked there some in the past. And so there was a time I was going to Vernon, British Columbia, and I went early and I got a bed and breakfast and rented a car and found a mountain that I could hike up by myself. And I got there that morning and there was no cars in the parking lot, and I can see the top of the mountain range, the snow-covered ridge line. And so I start hiking. I'm so excited. I've been planning this for months, and I start obsessing about some stupid thing I'm too embarrassed to tell you about. So here I am on the hike, and I'm totally not present. Totally not there. Gone. I'm in my head, right? And so this goes on ad nauseum, and eventually I say to myself, what do you do for a living, right? And as soon as I said that, I came up with how I was going to respond. And it was like this. As soon as I noticed the obsession pop up again, and see, that's the first intervention. As soon as I noticed it. So to notice it means I've separated myself from it, just that little bit. So now I have some room. So as soon as I notice it, my response is, thank you would you give that to me again? And then I turn my attention to my activity. That's how you score a point. You got to go back and turn your attention to the hike. Now, 8 seconds later, up pops the worry again. I don't care how many times it comes up. That's my stance, which is if this goes on the rest of my life, I don't care. Here's how I'm going to respond to it. I mean, I knew that wasn't going to happen, but that's an attitude of I don't care. I'm just going to stay with the protocol. And so I just, every time it came, I'd step back and go, thank you. Would you give that to me again? Turn my attention back to what I wanted to do, which was hiking. And eventually, of course, I wouldn't tell you this story unless it was true, but eventually that faded out, and then I was present to the moment, and that was gone. So that's an example of how we might be challenging OCD or worry or panic in the moment.
So it sounds like what you're advocating is that people need to exercise courage first and comfort later. And that makes a lot of sense to me. How about those among us who are a little on the timid side? How do you coach them in courage?
Well, first we want to get clear that people come in to me to work on this, or people with anxiety want confidence. They want to know how things are going to turn out. And confidence is a really bad idea. You're not going to learn anything if you must simultaneously be confident. So we do want to just, we can educate people a little bit to say, wait a minute, confidence is after you do this a bunch of times. Confidence is what keeps me in my house. So I want to connect with them around the idea that because they've been looking for confidence before they step forward, they tend to step back or stand still. They want, the reason they're looking at this stuff is because it's limiting their life in some way. So I do want to just, as you're saying, talk about the idea of courage, which means I'm going to be scared and do it anyway. I want to explain to them how being scared and doing it anyway is the correct path. So I don't, I'm not one who does techniques with people. It's not me. And we have trouble teaching people when we lead with technique. I want people to have a perception of the nature of the problem in a very big way. Not all these details, but very big way. And there's only a few concepts that we want. And then in a big way what my shift can be. And then they can invent their homework. The big way is anxiety is going to come back to you and scare you and make you think something's dangerous or threatening when it is not, and is going to tell you that you don't have what it takes. So, right? So if it gets you to believe what's coming up next is really big and difficult, and what you have to offer is small, insignificant, of course you're going to then back away. So we want to see that as anxiety's game. And then we've got to, okay, well, if that's what anxiety wants me to do, I'm going to do the opposite, which is I'm not going to wait for confidence. I can't wait for confidence. I'll stand still.
What do you say to people who come in and say, I clearly have too much stress in my life. This is a stress problem. You have to put yourself in uncomfortable situations, which will bring up stress. So it sounds counterintuitive from the things we're learning now about, people need less stress in their lives.
Right. Well, that's not going to happen. But all those things you just listed, those are great things. So especially people who have what we would call generalized anxiety disorder. They're worriers and they worry about a bunch of things. Our autonomic nervous system has two branches, the sympathetic, which is the anxiety and panic, and then parasympathetic, the relaxation response. It's what we get when we do meditation and relaxation training and so forth. People who are worriers, they're parasympathetic. The ability to relax is a very poor student. So actually to assign somebody to take yoga or learn meditation or go out to get some exercise and so forth, these are all ways, we want multiple ways to train the parasympathetic that they can let go. And so those are general skills. In the moment, if I want to take a little brief breathing skill, I don't want to do it with the goal of relaxing. I want to do it in the moment with the goal of focusing. I don't need to relax. See, the bad news about all this work around relaxation in the moment when you're threatened. This is it's arousal incongruence, which means I'm anxious and now I have to change my physiological state to relaxation before I go forward. That's a very difficult task. So if we can work with people to be arousal congruent, which means it's fine for me to still be anxious. Now I need to focus my attention on my skills. Those skills are not complex. They're simple. I'm from the South. We can't think complexly. So this is a simple protocol, but you got to focus your attention. And just to clarify, I don't teach relaxation to many people at all anymore. I do around those who are worriers, but not for panic disorder, not for social anxiety, not for OCD. None of the other disorders do I do the relaxation stuff. But, when you're a worrier with generalized anxiety, you just need a little more help.
One of the things you advocate is learning to be comfortable with being awkward and discomfortable and uncomfortable and making mistakes.
Yeah. I'll write that on the whiteboard sometimes. I want to purposely, voluntarily seek out opportunities to feel awkward, clumsy, insecure, embarrassed, all of those feelings, because again, it's opposite of what the challenger wants, and it is the only way we're going to learn things that we feel we really don't have that confidence yet. So we want to go, instead of, I used to, 20 years ago, say you got to tolerate those feelings. And I think that's too soft of a stance. There's a lot of difference between saying, I'll tolerate this and I'm seeking this out. That, it's even saying I'm willing to feel those feelings is a softer stance than I'm looking to feel those feelings. Now I've got more ownership there. It's like if they show up, I was looking for that. And that, I truly believe that's a more powerful stance to take.
Is the seeking out, is the action.
Is the seeking out as opposed to the willingness. Now, maybe you have to start with willingness, but, throw your hat over the wall, which is, I'm going after that. I'm looking for. That's kind of why we do point system. That's my, if you see somebody who is afraid to, ask a woman for a date, the assignment somebody might give them in cognitive behavioral therapy is, how about getting 4 rejections in the next 2 weeks? And, you're seeking out those rejections. That's what you're looking for. So when that happens, you go, cool, I did it, right? Exactly the thing you're afraid of. You've elevated that because you're working on something specifically. I'm looking for the embarrassment that comes with being rejected. So let me go for it. And of course, they typically get one date out of trying to get 4 rejections because they're a little more relaxed about it. So.
Right. Well, Dr. Wilson, I want to thank you again for joining us. It's really, it's always such a pleasure to talk to you. Thank you so much. I look forward to seeing you again in September when you'll be back on the boards at the Brattleboro Retreat on September 16th. I just want to give a plug for your videos, which are available about your work related to stopping the noise in your head. And it's at www.noiseinyourhead.com. So thank you, Dr. Wilson. Thank you, BCTV audience, for joining us again here on Keep Talking, a community dialogue about mental health. I look forward to seeing you again.